Welcome to the Fusionary Health Podcast. You are in store for an incredible episode today. To all my listeners, I have an incredible guest, Dr. Branson Collins. Welcome, Dr. Collins.
Thank you so much for having me. Pleasure seeing you, Shivani.
Of course. So, Dr. Collins is a repeat guest. Way back when, in the first batch of episodes I ever did, I had him on the podcast. He's an incredible functional medicine doctor right here in Boca Raton, Florida. And many of my clients, when people come to me and they have a big autoimmune stack up or a stack up of issues, and I'm concerned that I might not be able to address the whole thing, and I want good diagnostics and good understanding of those issues, I call Dr. Collins and I'm like, I need you on board with this client. I need them to see you, get the testing done. And I look at you as a Dr. House. I look at you as someone who gets in there and digs into the problem and finds the weird, crazy thing that was going on that none of us would have thought of, but you find it for the client. So thank you for all your help this last few years.
It's my honor. It's my honor. I appreciate it. Thank you so much.
For sure. So let's share a little bit about Dr. Collins. So you guys know who you're listening to today. He's a triple board certified physician who's board certified in anesthesiology, pain medicine, and anti-aging and regenerative medicine. So in addition to being a spinal and musculoskeletal interventional expert, he also applies the principles of integrative medicine to optimize the health and well-being of his patients. And Dr. Collins received his Bachelor's of Arts in Biology at Rutgers. And then he went on to study med school and so much more. And I know, Dr. Collins, today we're going to dive into the topic of trauma. And a lot of times people think of trauma as, okay, something happened, I got over it, I want to move on. Like, why are we talking about that? We're here to talk about my health. And the thing is, what I think people don't realize is we all have different traumas and they have physical, emotional, and mental impacts that are very long lasting. You can call COVID to the whole planet a trauma that happened to us, and we stored that somewhere. And it could be loss in your family. I've had a lot of loss in the last year now. And it's like, well, that's going to place itself somewhere. And in the Ayurvedic sense, it's going to cause blockages. It's going to cause inflammation. It's going to cause problems. And if we don't address it, it's going to become something that's festering. So will you start us off with your perspective on trauma and the importance of it for our health?
Absolutely. And so we had recent conferences regarding trauma and the kind of the next phase and how we're really looking at ongoing stressors in people's lives. And we're kind of looking at trauma now as almost like a redefinition where trauma really can be defined as any stressful event that happens during a state of vulnerability.
Okay.
And when you look at that, you can see how we may see massive traumas in people and ones that are well recognized, war veterans and trauma, people who get into motor vehicle collisions. But a lot of times it's the smaller traumas that add up over time that kind of build up and these kind of stressors over time. In functional medicine, we call it the allostatic burden, right? So it's these cumulative stressors that have an impact on us. And very much so, those stressors, when I talk to my clients, it's like we have this bucket of stress aptitude that we can actually all take in. And then that faucet is the ongoing stressors that happen. And each person has their different allostatic load that they can take on before it starts overflowing. And the most fascinating thing for me in trauma now is we've known in functional medicine for a couple of decades now that one of the potential triggers for autoimmunity is a traumatic experience. And I with the ongoing research with the microbiome and the gut-brain immune connection, we're getting better at that, but in certain ways, our tools for identifying and treating the nervous system are sometimes lacking. So I see this as the next phase of how we're really going to be helping people with not only their wellness, but also with helping their immune system to be back in balance and to really help people to be back on kind of their into their balanced state where they have homeostasis and wellness. A lot of it is going to be based on dealing with their nervous system and helping them to be more resilient.
It makes total sense because a lot of times when people like me, for example, go to functional medicine, what we're saying is, I want to be optimized. Something isn't great. Something isn't working. And when we do all that great diagnostic testing, we come to get some answers. You're super deficient here. Yeah, we can see the gut has a hit here. These are the issues we need to address, hormone replacement therapy. But if we're not going to address those traumas or micro traumas that are consistently happening, you can equate it to a mold exposure. You're not going to address the mold in the house, you're still going to have the problem. So if we're not going to help the patient understand, hey, this thing is a chronic stressor for you, we need to address this too. So when it comes to the nervous system, before we get into that, how do you look at the nervous system, and how have you seen supporting people in understanding being in parasympathetic is the way through to shift their health, their stressors, as we're calling it, and inflammation?
That's a great question and great point. The nervous system as a whole, we understand the different arms of the nervous system, and we have our central nervous system that we think about, like our brain and spinal cord. An important part is the one that's in the background, right? The autonomic nervous system, right? So we have our fight or flight and our sympathetic nervous system, and then our rest and relax parasympathetic nervous system. In today's society, people are very dominated by their sympathetic nervous system, right? It's the one that keeps you vigilant. It's the one that keeps you being able to have that edge. And we start doing things like heart rate variability monitoring, and actually doing objective analysis as to people's tone. Are they more dominant for the fight and flight or more dominant for the rest and relax? And very commonly, people are sympathetically overdriven. And we know that that creates chronic inflammation. We know that actually has effects on the microbiome, and actually having bad effects on the microbiome and creating more pathogenic bacteria. And we also know that it creates this interface where our neurotransmitters that are interacting with our vagus nerve and our major nerves for our autonomic nervous system are now disrupted and imbalanced. And that has a major impact on health.
Well, I'm kind of smiling because I'm like, that's me. We're talking about me. Of course, I'm more in my sympathetic. My whole life is about building and growing. And so, what I've learned from Ayurveda is just because you want to build and grow and change the world doesn't mean you don't have to take care of this body that you've been given. And so, I equally build time to relax. But I'm one of those people who, even though I'm relaxing and chilling and doing self care, I'm like, I should work more. And then I'm like, no, no, no. We know there's a yin and yang to this. We know that we have to be in rest and digest, or we're never going to absorb nutrition. We're not going to win at our health if we're always in the overdrive. So, will you explain some of those, I call them punishments, or some of those bad things that happen in the body if we are not giving ourselves rest and digest time?
Right. So one of the punishments is that one of the major inflammatory cytokines that develops, these signaling molecules, when we are in this high cortisol or high sympathetic overdrive state, we're always running from the tiger. Things like IL-17, which is a cytokine, actually increases autoimmunity risk. And when we do these measurements and panels in functional medicine, you can actually see people shifted in terms of this inflammatory signaling that's driving some of their inflammation. And this can often be the missing piece. I've seen a good amount of people that their diet's getting dialed in, they're on a whole foods diet, they're eating organically, and when you're looking at, wait a minute, why is this person still not 100% better? A lot of times it's because they're busy, they're having trouble with being overcommitted, they're having trouble with being overly in this fight or flight response, even when it's low grade and they're not giving themselves enough time to relax. So the deleterious effects can have impacts on every single organ system, right? We know it can have impacts on the brain. One of the complications of having long-term chronic stress is our memory starts declining. It's actually a protective mechanism that happens where part of our brain called the hippocampus actually starts down regulating and actually starts losing some of its neuron and its connectivity. So with people who have this brain fog and this memory disturbance, it's actually the brain's protective way of trying to help the brain and help the nervous system from this high cortisol state.
Wow.
So that's one part. The other part is you hear of people with nervous stomachs, right? So that's this interface of that nervous system with the gut, and people get digestive issues. They don't absorb nutrients as well. And we're also seeing that this hypercortisol and high sympathetic output state is actually driving GI imbalances, especially things like dysbiosis, where we're getting more imbalances with the bacteria that aren't necessarily helping us the most.
Sure. So, those are some pretty hefty punishments. When it comes to trauma, how in your practice are you assessing if people have traumas? And then what are some of those recommendations that you make?
Right. So one of the things that we're doing, we're working actually with a lot of veterans, especially because of my background as a veteran. I'm in the military, very interested in that group of people. But there's different scoring systems like PCL5s that you can do to actually um, objectively get analysis on people's level of traumatic experiences, how it's impacting them. So that's one way we use questionnaires, and also just getting a really good history from our patients. I mean, when you really dig down and start asking people questions. Like I said, the big traumas are ones that stand out for people, but then the smaller ones, people who maybe their parents, when they were growing up, they were kind of in this overachieving state where they were finding that they had a lot of pressure on themselves as children, and also maybe they had things like their parents getting divorced. Those all are traumatic experiences. So getting that history is very important also.
So, when it comes to traumas and people who come to you who have trauma going on, what is your best way to assess, understand it, and then help them address it, really?
Right, that's a great question. And I'm finding that because of the smaller kind of micro traumas and the small T's playing a role in many people, what we're finding is that it really just takes a really good history. I think getting a really good understanding of the background of your patient. And in that, you may find that there were some childhood things that were happening where maybe they were expected to be overachievers as kids. Maybe they dealt with some loss in terms of their parents getting divorced, and when you get that feedback from your patients, you can start seeing how that actually can be having impacts on them into the future. There's also ways that you can do, classic objective studies or questionnaires which can look at trauma scores, and those can be very helpful too. So usually we'll use a combination of those.
I had heard a TED talk that talked about traumas and trauma scores and how nearly not I mean nearly everyone has a trauma level of I think and I'm sure you know the terminology behind it, but it was like a 1, 2 or 3, and then there's people who have much higher trauma scores, and it talked about the correlation between our trauma score and not they weren't as focused on disease but behavior, like suicide rates or
Yeah.
levels of people being jailed and things like that. So can you speak into that a little bit?
Right. So when we look at it, 70% of people are affected by trauma, right? Of those 70%, about 20% get the classic diagnosis of actually a post-traumatic stress disorder. So it's actually a very significant amount. And based on what I'm gathering in my clinical practice, I think we're under treating and under identifying when trauma is affecting people, right?
Sure.
So the way that we're looking at things right now, there's this big push towards metabolic medicine, right? There's this big push in integrative medicine of the whole body approach and root cause approach. And because more and more physicians are looking at trauma leading to things like metabolic syndrome and leading to things like insulin resistance, and we haven't thought of it in that way before. And there's a few reasons for that. Trauma driving, this axis with the HPA axis kind of dysfunction, affecting glucose dysregulation, affecting how we actually reach for the cookie or reach for the refined sugar to kind of feed that, right? And this has a downstream effect on things like inflammation and even what we're seeing with neurocognitive issues and dementia.
It makes total sense.
Mhm.
But you're right, no one's talking about it. Every functional medicine conference I go to is like natural GLP-1, let's help everyone's metabolism. No one can lose weight. Like that's the whole conversation. Where previous, I don't think it was such an obsession with that. I think it was much more, why is everyone's gut health such a problem? What are we going to
Right.
do about it? What are all the reasons and the intricacies of that? And as we've come to understand the gut microbiome more and more, we
Mhm.
have so many more tools to address it. But that's so interesting because you're right. Let's say someone had a trauma when she was 18, 19, 20. I'm thinking of someone specific in my life, and this trauma sent them on a path through their college years of over drinking, which is sugar, over addiction to sugar, not realizing it. A lot of times, young people nowadays are super addicted to sugar, and we think, oh, that's just they're kids. They have that tolerance. Not quite taking the step back and saying, why is it there? And then fast forward those poor habits. Then we have metabolic dysregulation issues. We have A1C's climbing towards prediabetes and these things.
Right.
So, in your clinic, have you seen that once you're able to figure out what the trauma was and help them address it with your tools, you're able to support their metabolic health in a completely different way?
I found that, and a lot of what we do in our clinic is we, really identifying, what are the adrenal glands doing, and looking at things like diurnal cortisol. And of the things that we manage, I find that is one of the more challenging things to help people to balance,
Sure.
right? So that's when we're really looking at, okay, what kind of tools are we doing are using to look to see what is the balance of your nervous system. Are we doing like these deep breathing exercises to activate the rest and relaxed nervous system? And even what we're seeing now with the benefits of things like blocking some of the nervous system bundles that are supplying into the emotional centers of the brain and doing injections to actually help that. That's another whole facet in what we're doing.
Will you explain that? What do you mean by injections?
Yes. So for the past couple of decades now, there's been a movement of using ultrasound guided injections of something called the stellate ganglion.
Hmm.
And the stellate ganglion is a nervous system, sympathetic nervous system bundle that's in the neck. And
Okay.
it's been injected for years in chronic pain. And what we were doing in those scenarios, people would have, for instance, a crush injury in their upper extremity, and they would have associated with that post-traumatic stress disorder and reliving the event. And when we would do these injections to help their pain, we were getting feedback from the patients. Not only were they sleeping better, but they were having less intrusive thoughts, and they were actually, their emotions were more regulated. So
Hmm.
fast forward, some very brilliant doctors, one of which named Dr. Mulvaney, started putting this into research, looking at when we block the stellate ganglion, are we seeing improvements in post-traumatic stress disorder scores? And we have recent studies showing that there's significant benefit in doing those injections, and that's something that we're applying to our clinical repertoire here at the Marcus Institute on a regular basis now.
What are you injecting?
So, so this has been looked at in different ways. So one of the things we inject a long-acting local anesthetic. So it's a local anesthetic that we would use similar to anesthesia when we do a nerve block, and we
Okay.
actually inject the stellate ganglion with this local anesthetic that's long-acting, and for about 4 hours, it's allowing this nervous system to reboot. It's almost like rebooting a computer.
Wow. That's interesting.
Right. And along with that, this is being looked at now, not just in post-traumatic stress disorder, but
Hmm.
also in things like long haul COVID, also in things like executive functioning. Because as we discussed earlier, hypercortisolism is leading to degeneration of the hippocampus, memory dysfunction, executive functioning not being as sharp. And of course, you can do all the fancy things with hormones and balancing and things along those lines. But now we have a tool to actually work on the autonomic nervous system in a way that is evidence-based, and also in a way that actually is targeting the autonomic nervous system in a way that nothing else really does.
So, how does it work? My brain's trying to imagine this. You take a patient, you're injecting them. You've done this in the past for significant pain, chronic pain. You
Right.
must be relaxing them completely. You're hitting the reboot on the nervous system, which you were trying to do in many ways, right? Like I've been told by functional medicine every morning, meditate, deep
Right.
breathing. And I'm like, yeah, these kids have to get out the door for school. So a
Yes.
lot of times I can do that later. Like I consider my evening routine a time to do that. But
Mhm.
let's say the client has a busy life, which is why they're high cortisol. They're not able to make the time yet for all the beautiful things we want them to do that'll help with their hormone health. And let's say they have some significant issues and struggles with their health and things that we're talking about. You're telling me that by hitting the reboot button on their nervous system, it's been seen that we can reverse, in a sense, or undo that PTSD trauma that's the underlying issue that's driving so much of the issues that they're struggling with?
That's what we're seeing. And there's different approaches to things, and I find that each physician that does this their own artist in many ways. But there is a set and setting aspect, right? When there's I incorporate all the theories into these when I do these injections, where I do set, place of safety, right? The a client comes in, and we say a little intention of something that's positive for them. And I say, some people make statements like, I'm totally going to heal. Other people make statements like, my trauma's gonna wash away. right? And we kind of set that intention and we put on calming music. And the injection itself really only takes me a few minutes. It's a painless injection.
Mm,
And then we have conversations with them after. And I also will have certain people that I have coaching with them along the way, just to
nice.
help with integration. Because as we're finding, similar to what we're seeing in other modalities that are working on the nervous system, there is an aspect where integration and working with somebody actually can be helpful for these outcomes, because it's one thing to open up the box and that's another thing to kind of integrate and understand kind of what we're now allowing ourselves to process, right? And that's kind of the balance and everything.
Sure. And are you talking more about talk therapy or more about health coaching?
Both go hand in hand there, but in particular the talk therapy I find can be more beneficial in these scenarios. And people who've had the stellates have described it to me as if they've said that the stellates allowed them to now process their traumas, where it kind
Hmm.
of open them up to be able to actually recognize and process. And what we're finding too is it'd be nice, just like anything else in medicine, if things were just, if one time you do it and everything's perfect, right? That would be fantastic, right?
Yeah.
And Sarah Godfrey, one of my colleagues, puts it very well, and she has a new book on autoimmunity and trauma that I
Mm,
encourage people to look at. But one of the things that she brings up is that this trauma setting, this inflammatory cascade, is something that it's each person's individual experience, right? So each person is an N of one study, right?
true.
And that's the beautiful part, and that's why we personalize our therapies for people. Everybody's an N of one. So some people get one injection and they're doing fantastically. And other people have found when they actually do a few injections within an 18-month period, that's actually been their secret sauce.
Nice. It's so interesting. Recently, I was talking to a client, and she has a family member who's going through a big trauma in their health. Like right now, my generation is dealing with our aging parents, and it's really hard to watch. And the comment was, she needs to go get some therapy because what she just went through handling this case with her mother for a few months now has been really, really rough, and nearly losing a parent is a lot. And the feedback was, no, I'm not going to therapy. No, I don't need personal development. I don't need anything. And I thought to myself, I was like, we all have blind spots, myself included, of course. But when I have an issue that's festering in my mind and I can't process it myself, and I know my close inner circle can't process it for me, I always make sure that I go and see my therapist. It happened when I had a loss in my family last year. I was angry. And I was like, anger is an interesting emotion to have from a loss. So I went to therapy and we unpacked it. And she's like, you try to control everyone's health and you can control this one. And now you're mad. Are you God? And I was like, no, I'm not God. I got you. It took a while though to get me to that point of understanding. And so in your practice, it's so interesting that you're pulling out an entirely different toolkit than what most of us think of to address this.
Right. And that's something that as we're really growing our experience with our patients, I love the functional medicine. I love the gut, brain immune connection. I love all those things. And for some people, that's all they need, right? You get their diet better, you get them exercising a little bit, you give them some energy, you balance some hormones, and they feel fantastic and they feel 100% better. And I'm finding that because of the level of what we do get some of the more challenging, more dynamic, or more complex um, patients in front of us, and I find that they need every single tool in their toolbox as a possibility to get them better. So, and when you're working on their nervous system and working on their autonomic nervous system in a way that hasn't been done before, so dramatically, that's actually what allows them to actually get to that next phase of healing. And that's we've been seeing some amazing outcomes with that.
Nice. And I know beforehand we were talking about veterans and how PTSD, I think we don't think about it often until it's something that happens to us or someone close to us. And so will you speak into how you're working with them as well?
Yes, so I'm working with some nonprofit organizations, one of which is For the Love of a Veteran, and their dedicated mission is actually providing stellate ganglion blocks to veterans with post-traumatic stress disorder. So they're they're committed to actually helping veterans in this way. And different high level podcasters have had people who've had these kind of injections done for post traumatic stress disorder. And my role is I really provide the ultrasound guided stellate ganglion block for them. And these are people that have complex long-standing issues and they're still noting benefit. And this is oftentimes without a lot of the integrative therapies that some of my other clients may necessarily kind of come in. They come in, they get the hormone balancing, they get their microbiome evaluated, they get their nutrients optimized. And our veterans organizations are looking at this as a way that we can actually reboot and help our veterans with some of their complex trauma. And more organizations are actually taking on this cause.
I have a question. When in my world, I'm usually working with orthopedics and they're dealing with pain.
Mhm.
And a lot of times when I've spoken to people and I've said, I have I know that there are solutions that are natural and they can cut down opioid use. Have you seen that people who have become addicted to opioids are oftentimes dealing with an inner struggle, and then this can be the support that they need?
That's a great point, and there's been some very interesting trauma specialists looking at things like addiction and dependency,
Hmm.
and some of them have said that a lot of that addiction dependency is rooted in trauma, right? So we have this scenario where there's this forward feeding where somebody who may be more predisposed to addiction or dependency and may have genetic predisposition now gets put into a place where they do have an injury and now they have a chronic pain. And there's this balance where now they're identifying themselves as this chronic pain person.
Hmm.
And now that cycle and that neuroplasticity that's going on, that circuit in the brain is kind of driving that circuit where they're getting reinforced that this is their experience, right?
Right.
So that's why things that can actually help reset and reboot are some of the most intriguing studies that are being done nowadays, especially as we're seeing cognitive issues not be on the decline, they're on the incline, right? So we're
True.
seeing things like Alzheimer's, we're seeing Parkinson's, autism, we're seeing like more numbers of these than not less,
Right.
right? So with those things in mind, we're looking at how can we actually protect the brain, protect the nervous system. And when we look and we see that the sympathetic nervous system a lot of times is at the root of a lot of this.
Right.
And in functional medicine, we've been doing better with looking at the microbiome and the gut. And then because I've always been a why physician, why is this person not 100% better? What are we missing?
Right.
What I'm seeing currently, as I've been practicing this for over a decade now, is that the nervous system and the sympathetic overdrive, the better we can control that, the better we can actually do for our patients.
It makes total sense. And let's broaden this a second. So let's say a person's not the candidate for what you're talking about, which I think it's always good to know all the options on the table. I'm a big
Mhm.
fan of understanding, like, okay, if end game is injection or surgery, and that option's a great option on the table, what are all the options before it? What I hear you saying, which I believe to be true as well, is our nervous system nowadays, we're usually completely in the wrong direction. We're usually in overdrive. I know for myself, I wake up and it's go. I've got to get these kids up. We've got to get out the door. And as I'm trying to get out the door, I'm trying to do 500 things. Did you take your supplements? Did you take your water with electrolytes, your minerals, your running shoes? Post workout, you got to get to work. Did you carry your healthy organic lunch? Like the list, if I haven't prepared, is like 200 items on the way out the door. Get them to school, breathe, but then jump right into a high impact, heavy lifting workout. Then you get to work and it's like chaos with the work and the team and everything. And if you don't build in breaks, and I caught this recently, I've stopped building in certain breaks. I used to have a big tea time is me time break at 3:30. Because I took away one of my breaks, my whole system isn't functioning as optimally as it should. And I caught it and I was like, oh, okay, you need to build back the break. So I built evening breaks in. And my question to you is if people aren't giving themselves breaks ever, because it's one thing to the next, people have multiple jobs, multiple roles, maybe single parents, maybe kids who are in a lot of activities. If people are in overdrive all the time, we've already talked about the punishments, but I find in women when we're in high cortisol all the time and then eating late and then sleeping late, you find yourself in these cycles. So what are your toolkits and support systems for people leading up to the injection that you talked about?
For sure. The first step is reminding ourselves to breathe, right? And you kind of mentioned that in what you were talking about there. You know, what happens when we're stressed? We breathe more shallowly. We're not taking those diaphragmatic breaths. We're not exchanging as much oxygen, right? So first is kind of taking over the breath. Things like box breathing, that's fundamental. And everybody I take care of, there's nobody I don't have box breathing as part of their regimen,
Yeah, of
right?
course.
So that's how we are they getting clean air? Are they getting clean water, clean food, right? So fundamental pillars of health. These are things that we're always working on as a fundamental aspect of things. The other part is really looking at their individualized genetics, like what do they need in regards to their supplementation? Are they poor methylators, which also plays a role in trauma experience and trauma perpetuation, chronic pain, and inflammation, right? So as you're working on all those things, then you're kind of moving people down that road of improvement, and people are really buying in because they're doing better. So those are some of the fundamental things that we do, and then along with that, if I have identified whether it's somebody who may benefit from an injection for a chronic pain issue, for instance,
Mm.
something like a stem cell injection for a knee issue, right? Our strategy is that we don't just start with the regenerative medicine knee injection. Let's work on your metabolic health first. Let's work on your nutrient status. Let's identify if there's toxins. Let's make sure you're breathing, and then we do those kind of therapies, and that's actually when we see the most significant benefit because we've worked on the fundamental things. I call it building the foundation for the house. We
Right.
build the foundation first before we put on the window dressings and the paint and all these curtains. We want to build the foundation first because if we're not building on a strong foundation, that's when we can miss some things in terms of really getting the outcomes we want.
Sure. And I think people forget that when we talk about nervous system, gut brain, it's all
Right.
interconnected. And so a lot of times if I'm not feeling right, I just go, what have you done to your gut today? Like where are you at? And I will self-assess and say, okay, actually this needs to change. And so if we can give people these tools and show them, like even with breath, as simple as breath, we can create a state change. We can move from our sympathetic over into our parasympathetic nervous system, give the system a break, let it do a little recharge before we continue. Then all of a sudden, everything will be much, much better. And so, is there anything else you can think of that we didn't cover today as we spoke about this topic? Because I know you know so much about these topics. Is there anything we didn't cover?
Well, as part of really objectifying this sympathetic overdrive versus recovery, you're familiar with the different trackers that are out there, but I'm finding that the more and more people that I'm having track
Yeah.
their their heart rate variability to look at that balance, the more people I'm actually having being able to make behavioral changes. And I had a recent client from Idaho that a very high level jiu-jitsu person, very high level competitive CrossFitter, and they were just kind of able to perform at a high level until they weren't, and then they encountered COVID, and they noticed that they just weren't improving and weren't reaching their milestones they were reaching previously. And one of the things I identified is it's like, are you tracking your heart rate variability? There's so many things out there you can be doing this with.
Yeah.
And once he started doing that and he had that objective data to say, oh, wait a minute, I shouldn't be pushing myself 1,000% today.
Right.
Today, I need to rest and relax, stretch, do some sauna.
Sure.
It balances it out for people. So I do encourage people to get that objective data for themselves because it can really be a game changer, help people make strategic changes for their wellness.
Absolutely. When I talk to people about their sleep, I always make sure they're tracking because how can you know your sleep quality if you're not
Mhm.
tracking that data? So
Right.
yeah, I absolutely agree with you. So what are some of your favorite tools? Do you like recommending the Whoop, the Aura? Sometimes people have a Garmin that's pretty high level nowadays.
Right. It depends. I'm a founder of both the Whoop and or I've used both of them and I still use both of them. I do like them because they're continuous. The other straps where you can kind of check intermittently, but I do think the continuous ones are very good. And I'll base that based on their own activity level. So if somebody's a CrossFitter, Whoop band may be better because you don't want to have rings on your finger and be pressing a lot of weight. You can damage some structures there, right?
Yeah,
So I'll just personalize that therapy based on and that diagnostic based on kind of what they do with themselves.
beautiful. That makes so much sense. Well, Dr. Collins, it's always a pleasure talking to you. Will you share where everyone can find you if they want to come see you as a practitioner?
Sure. So I'm the director of Marcus Institute of Integrative Health here at Florida Atlantic University. So I'm here in Boca Raton. So you can find me online just searching my name and also the Marcus Institute. And I would love to help people in any way they need help. And thank you so much again, Dr. Shivani, for having us do this podcast again. Hopefully more to come, and we'll have many more interesting talks going forward.
I always love chatting with you. You always have such cool perspectives. Whenever I go and visit Dr. Collins, I'm like, what do you think of this? What do you think of that? How about this for the brain? And like me, you love to nerd out on all the
Mhm.
tools that are available to us. And for me, it's always fun to speak to a colleague who's into all these things like I am. So thank you again for joining me today. Thank you to everyone who's listening to the Fusionary Health podcast. Please like and share this with someone in your life who needs to hear this message today and help get this message out there. Our ability to use integrative and functional medicine and holistic medicine practices like Ayurveda is the way forward to build the health and the world we all want to see. So thank you all for joining me today.
Thank you so much.
Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.